So I did my training as a certified health coach, which really brought home the importance of a whole person approach for overall health, including diet and nutrition, which I think is something that's really overlooked in the clinic, generally speaking.
Hello and welcome to the Dental Protection Podcast. I'm your host, Dr. James Foster, and today I have the pleasure of sharing with you that Dental Protection will soon be hosting the Asia Spotlight on Risk Dental Conference at 2 p.m. on Sunday the 24th of September. This conference is first and foremost for our Dental Protection members, but I should also add that any dental practitioners are able to join. If you haven't already registered, do look in the podcast description for a link. Well, today we'll be hearing from Dr. Suriner Arora. Surinder is a general dental practitioner based in Singapore who graduated from dental school in the UK. She takes a holistic approach to dentistry and has clinical experience across multiple UK hospitals under various facilities, as well as in general practice across the UK and Singapore. Dr. Arora has an MSc in Public and Mental Health and is a certified health coach. She's published research on the topic of burnout in dental professionals in Singapore, and as an advocate for wellness, she teaches Kundalini yoga and meditation practices to manage stress and burnout. She also volunteers her time to the SDA Ethics and Welfare Committee, as well as to outreach projects both overseas and in Singapore. Now, about the conference itself, our Spotlight on Risk is a flagship virtual event in Asia, and this will be the inaugural edition, covering Hong Kong, Malaysia and Singapore. Now, the conference is aimed to dental and oral health communities, bringing together local and international speakers to provide guidance and help professionals to practice safely and ethically. The event provides an opportunity for delegates to examine the many ethical and dental legal challenges and the risks they face as clinicians. The conference will be delivered as a virtual event held over 2 hours and 15 minutes, with delegates having the opportunity to ask questions live to all speakers, as well as answer interactive poll questions throughout the session. This year's Spotlight on Risk conference will cover some key dental legal and ethical issues, including social media through an ethical and dental legal lens, a typical day in the practice with case studies that we've seen here at Dental Protection, and restoring balance and cultivating resilience. The programme is put together based on feedback from our members and input from our dental legal and legal experts within NPS. And Surinder will be speaking in relation to restoring balance and cultivating resilience. Now, we know in an increasingly complex and uncertain world, it is likely that most of us have experienced some form of work-related unease, anxiety, stress or fatigue. In constant pressure, we enter on survival mode, forgetting to think about our emotional, physical and mental well-being. And to thrive, it's important not only to restore the balance between work and personal life, but also cultivate the ability to reflect, learn, rebound, and move forward. Alongside Surinder, we also have Dr. Ronald Chan, Chairman of the Board for Modern Dental Group and Honorary Clinical Assistant Professor from the University of Hong Kong. We have Charlene Adrienne Chin, who's a partner at RDL, that's Raja, Darrell and Lowe, our panel firm in Malaysia. And my colleague here within NPS, Dr. Louise Eggleton, a dental legal consultant who manages Asia cases. So turning to you, Surinder, it's wonderful to have you with us today, and thank you very much for your time.
Thank you so much for having me and for that lovely introduction. I'm looking forward to answering your questions.
Well, we'll get straight into it then. So perhaps we could start by asking you to tell us about your own personal journey and your areas of practice.
Absolutely. So personal journey with regard to dentistry, I'll keep it to that. When I was about 16, I did work experience at a dental clinic. And I find it incredible how at that age, we really need to decide what we want to be doing for the rest of our lives. So for me, it was between dentistry and law. And after doing work experience, I decided on dentistry. So I studied up in Sheffield. And after doing my undergrad, I was down in London. And I did my DFY1 in London with Raj Ratan, actually, as my key supervisor. So then I did an oral surgery and restorative post in London hospitals. And I was also working in private practice. And again, it was just astonishing how challenging at the time it was for a young dentist with little clinical experience to get a job at that particular time. Enter an overseas position in Singapore. And now I'm a general dentist who does indeed take a holistic approach to oral health care. And I'm based at Nuffield Dental in Singapore at present.
Yes, I would agree. 16 is a very young age to decide your future career. But it's impressive that you went to do some work experience and just look at the environment, because I think many people don't get that opportunity or take that opportunity to try and engage to see if it's for them. You talked about your holistic approach, and I know the Kundalini Yoga and your role as a health coach. Love to hear more about those.
Yeah, sure. So in the early years of my career, I noticed how a range of people were getting dental disease. And some of them appeared to be doing all the right things and still had dental cavities or perio. So I did some training in different healing modalities. And one day I had this like aha moment of, I want to be a wellness coach. And this was around 8 years ago. So the world was a little bit of a different place there. It was like, does this even exist? And sure enough, it did. So I did my training as a certified health coach, which really brought home the importance of a whole person approach for overall health, including diet and nutrition, which I think is something that's really overlooked in the clinic, generally speaking. And then on my spiritual journey, I'd been practicing Kundalini yoga and finally went for the teacher training, which was in Sri Lanka. So Kundalini yoga uses asana, so body posture, mantra, and breath work to balance the energy systems or chakras of the body. And I think some of this terminology historically was a bit like, oh, what is that? What is this meditation and yoga? But now it's really common. And pretty much everybody has heard of meditation or mindfulness and yoga, and there's definitely a greater interest towards it. The crux of it is, I feel that we're multidimensional beings with like mind, body, emotions, the mental state, and the energetic self. And all of these factors contribute to our health. So my newfound learning naturally infiltrated into the clinic, and I started looking more at the mouth-body connection, hence taking a more whole person approach to oral healthcare.
Fascinating. And of course, when you moved from the London hospitals, very traditional perhaps approach you might see in the London hospitals, and you come across to Singapore and you're investigating these other things, what more culturally different stood out to you when you came to Singapore?
You know, there are so many. And honestly, before I came to Singapore, I'd never actually been to Asia. So it was a little bit of a culture shock in many ways, particularly coming from the UK. So some of the things that stood out was the food, language in areas. So in the heartlands of Singapore, so not towards the city center, but out a little bit, there is definitely a language barrier. And I've worked in some of those areas where I've had to ask my DSA, my nurse, to translate for me. And then Singlish. So I don't know if you're familiar with Singlish, but it's like the can, the la, all of this, which is something you don't have in the UK. Calling older people uncle and auntie. This is something really endearing and lovely. Again, something different. And different work ethics, longer working hours, using WhatsApp for interactions between colleagues. So I think there's a beautiful blend of cultures here. In addition, you know, you have Indian, Malay, Chinese, other people from different parts of the world and overseas, and I really appreciate that.
I've been fortunate enough to have the privilege of traveling to Asia over the last few years, and it is fascinating, and seeing different cultures has been remarkable. The one thing that did and does stand out to me is the work ethic. And, you know, we have colleagues who are doing 3 sessions a day, maybe 6 days a week, even more. And obviously I was very interested then when I thinking about that and looking at the dental legal risks that pushing yourself too hard can bring. And of course, you've published a paper on burnout. Could you let us know more about the findings of that research?
Yeah, sure. So this was part of the Masters in Public Health and Mental Health. And it was a questionnaire survey of burnout amongst dentists in Singapore. And these areas were really of interest to me because everywhere I looked, my colleagues were like, oh, I'm getting tired, I'm getting stressed in the clinic, all of this. And we know the literature shows, you know, high suicide rates, all of this stuff that we already know, anxiety. But some of the consequences are really scary when I was looking into them. decreased work engagement, poor quality of care, reduced productivity in the clinic, compromised patient safety, suboptimal patient care. So really worrying things can come because of burnout. And particularly when you're doing these long hours, you get tired. I've done these long hours and it is absolutely exhausting. And then some of the reasons, the time and scheduling pressures, staffing issues, patient perceptions and expectations, and professional concerns, pressures with treating patients. So these are just some of the reasons that people would go into stress and burnout. So some of the key findings: 25% of the respondents reported a high or very high degree of burnout that they'd been experiencing or feeling of burnout, which is really worrying when the overall result was low to moderate levels of stress and burnout in Singaporean dentists. But this 25% is phenomenal. And in addition to that, around 9% responded yes to the question, have you sought support to coping with stress or burnout? And there was also about 30% of respondents that stated yes when asked if they required further support to manage stress or burnout, which indicates the support is just simply not there.
It is worrying to hear, and we offer our counselling service. The uptake in Asia is maybe not perhaps as high elsewhere. That's not to say the stress levels are there, but culturally it's perhaps something people don't turn to, but it is there. We'd always remind our members of the benefits of that. So moving forward towards the conference itself, we are looking at restoring balance and cultivating resilience with that in mind. And obviously, without telling us too much, could you give us a teaser or an overview of the things that you'd be talking in relation to restoring balance and cultivating resilience?
Sure. This is such a vast topic. And as humans, we have so many dimensions. So it's really about tapping into all of these aspects through self-observation and reflection, and then actually knowing what to do from there. So after making that observation, okay, what are my next steps? It's also worth remembering the world is changing at a tremendous pace, like never before. And we do experience the energy of others. So this is also something to note, that if you have a fight with your partner before you come into work, you might just be carrying that stress with you. Back to the conference, we'll be talking through some of the essential questions to ask yourself to guide yourself through. Mainly, what is out of balance? And then practically, there's the work hours, the toxic environment. What can we do about that? And also, what happens in your body when you start to feel yourself moving into that space of stress? And how in the moment can you manage that? I'll also be talking a little bit about strengthening your nervous system. This is absolutely essential, not only for the clinic, but in these changing times on the planet. We have so many different things going on right now. So strengthening your nervous system, the nutrition, the good sleep, the mindful practice, all of these things you can pull into your life. And even sharing some simple techniques to help you through your day that may be very practical and helpful for yourself.
Well, that will be exciting to hear and very helpful to our members, because as we say, this is a significant and highly relevant topic that affects a lot of us. In addition, might I ask you what other challenges are facing dentists in Singapore, and perhaps what are the opportunities at this present time?
So I think one of the biggest challenges are the working hours, particularly for dentists that have come in from overseas and aren't so much used to this. But a day could look like working from 9 a.m. to 9 p.m. And that's a long time to be at the clinic, particularly if you're fully booked. I don't know if people are always fully booked from 9 to 9. You often have breaks in between, but it's a long working day and you do get fatigued. I think one of the other challenges is building a book, particularly in private practice. This can take time, a lot of commitment. And I know a lot of young dentists have really struggled with empty books in Singapore. Saying that, you can serve a range of different patients carrying out various different treatments and really experience different areas of dentistry in the clinic.
And a question I'd like to ask colleagues who are on their career path and, unlike myself, are still in their younger years. And that question is, what would you tell your younger self if you were graduating now?
Okay, so for me, this is quite me specific. I didn't love dentistry when I was studying, and I was even looking at joining DPL at one point. Hence the exploration of other areas. So I would tell my younger self, you will find meaning and purpose in the work or service that you choose to do, and you will find this in the realm of dentistry. And I think that I remember speaking at the Young Dental Conference in London before I moved out to Singapore. And I mentioned to the audience, with dentistry, you can take it in so many different directions. So you've got your clinical aspect, but if you're into nutrition, you can really bring that into the clinic. If you're like a personal trainer, like these are aspects you can talk to your patient about. If you're into meditation, you can talk to your patients about it if they're open. So I really think there's actually something for everyone in dentistry. They would be the words that I'd be saying to my younger self.
Great. Well, it's fascinating to hear this. And, thank you so much indeed for joining us today. I appreciate you giving up your time, and also look forward to hearing what you have to say at the conference, which you've very kindly given us a teaser. And what an important area. We know of the dental legal issues that arise from situations where people aren't performing as they wish. They're not in a good place. And it is vital that we, as clinicians, look after ourselves, and this will be most beneficial. Thank you for that. Well, we'll need to bring the podcast to a close, I'm afraid. Thank you so much for sharing that with our listeners. If you'd like to hear more from Dr. Arora and from our other speakers, please don't forget to register using the link in the podcast description. I've been your host, Dr. James Foster. Thank you very much for listening, and goodbye for now.